It's time for another MU Healthcare Ask the Expert podcast, and our expert from MU Healthcare is board-certified dermatologist Dr. Jordan Parker, and she is going to be talking about, with summer here, how to avoid sun damage, also how to spot some early signs of cancer. So, Dr. Parker, where does skin cancer tend to show up the most?
That's a great question and an important one. Skin cancer tends to show up the most in areas where we get the most sun exposure. So think face, neck, scalp, hands, arms. For men, it's the back, and for women, it's the legs. But skin cancer can show up anywhere, even places that you might not think about, under your nails, between your fingers and toes, or on the bottoms of your feet. So when you're checking your skin or applying your sunscreen, try to be as thorough as possible.
Should people be thinking more about how much sun exposure they're getting day to day throughout the whole summer?
Absolutely. A lot of people think about sun exposure only when they're at the pool or on vacation, but the reality is it adds up from everyday activities like walking the dog, going to the mailbox, or even just driving. In fact, I often see more sun damage and skin cancers on the left side of the body because we drive on the left side. UVA rays can pass through car windows, so you have to be very careful even when you're doing these activities of daily living. That doesn't mean you need to avoid the sun altogether. We need sunlight for important things like vitamin D, but it's all about being aware of your exposure and protecting your skin when you can. That's also why skin checks are important. You can monitor for any changes and catch any potential cancers early, particularly when they're the most treatable.
Summer is here, and of course, skin care is very important. Sunscreen, sunblocks, all that stuff. You should be protecting your skin year-round. But we have got a board-certified dermatologist from MU Healthcare, Dr. Jordan Parker, here. We're talking about how you can avoid sun damage, how you can spot some signs of skin cancer early on with Dr. Parker this morning. So, Dr. Parker, can you explain what people should watch for when doing the self-checks?
Absolutely. What we like to teach is the ABCDEs. They're a simple way to remember what to look for when you're checking your skin at home. A stands for asymmetry. If one half of a lesion doesn't match the other, that can be a red flag. B is for border. Look out for edges that are irregular, scalloped, or look kind of like the edge of a scalloped seashell, or if they're poorly defined. C is for color. Most normal things are a single shade, but skin cancer can have varied shades of brown, black, red, white, or even sometimes blue. D is for diameter. If it's bigger than the size of a pencil eraser, that can be a concerning sign. E stands for evolving, which I think is the most important factor. Any spot that changes in size, shape, color, starts itching or bleeding probably needs to get looked at. Ultimately, if you see anything new, changing, or if it just looks like your ugly duckling and it feels off, schedule an appointment with your friendly neighborhood dermatologist at MU Healthcare. It's always better to be safe and get it checked.
Dr. Parker, you and your team at MU Healthcare, you're obviously specially trained in dermatologic care for skin of color. Can you explain a little bit more of that?
Yeah, skin of varying shades of color can look and react differently with certain conditions. For example, instead of seeing redness with inflammation, in darker skin, you might not see that at all. You might see darker colors or even as dark as purple. There are some conditions that are much more common in patients with darker skin tones, like keloids, certain types of hair loss, and pigmentation disorders. If a provider isn't trained to recognize how these present, it can lead to misdiagnosis or the wrong treatment approach. That's why specialized care really matters. Our team is trained to treat all skin types, and we make sure every patient gets the right care for their unique skin and hair.
So when should people start getting yearly skin screenings, and what can they expect when they go for that visit?
It's a great question, and there isn't an official recommendation, but I usually recommend that adults start getting a baseline skin check in their 20s or 30s, sometimes earlier if they have risk factors like very fair skin, a history of a lot of bad sunburns or tanning bed use, or especially if there is a family history or a genetic predisposition for skin cancer. A full body skin exam is very quick and non-invasive. We'll check you from head to toe, including places you might not think about, like the scalp, back, and between your toes. You do not need to prep or shave. I don't care what kind of underpants you're wearing. Just avoid wearing makeup or nail polish if possible so we can see all of your skin clearly. If we find anything concerning, we'll either monitor it or do a quick biopsy, often right there in the office. It's all about catching things early and giving you peace of mind.
Get that screening scheduled now, right? Go to muhealth.org/skin experts. So obviously there's 1,000 different SPFs and different brands and sunscreens and all kinds of different things. Confusion. What do I get for me, for my kids? Is it the same? Is it different? Help us out here.
That's a great question. I get asked this question probably multiple times a day. I like to tell my patients that my favorite sunscreen is the kind that you'll wear. But if you're asking me what my favorite kind is for myself, it would be SPF 50 or above, and I tend to recommend mineral sunscreens over chemical sunscreens. Mineral sunscreens are going to have ingredients like zinc or titanium, and these will actually block UV rays rather than just scatter them like chemical sunscreens. If you don't like sunscreen, that's A-okay. Make sure you're wearing sun protective clothing, doing important things like avoiding peak UV rays like between 10 a.m. and 4 p.m., and just doing your absolute best to be aware of the sun exposure that you're getting because it will prevent skin cancer.
Find out about all the services offered from MU Healthcare, especially on dermatology, and schedule that skin screening. muhealth.org/skin experts.